from my rhinoplasty procedure. Sorry, I'm kind of cosy in my dressing gown because I just got home from work and I'm quite tired. So today was my first day back to work, like my new job that I've got since having my rhinoplasty. So my first day, I was a bit nervous anyway. Obviously I was a little bit more kind of conscious about my nose or my scars or whatever, even though I'm pretty sure nobody even noticed, because I didn't know why I looked like before really. I mean, they saw me in the interviews, but that wasn't like a month or two ago, and they only saw me like twice, so I doubt they particularly remember my nose. And also, obviously, I put foundation over the edge of my scars. But I saw my friends today after work as well, and they said like they can't see any scars, so I don't see why people at work that don't even know me would. So obviously, it's more in my head. What else? Oh yeah, today it felt like my nose was quite blocked up. Like, since yesterday I kept sniffing quite a lot, like as if my nose was running where it wasn't, so I'd be constantly kind of like because I didn't really want to blow my nose so much, because I know it said somewhere like not to blow your nose for 2 weeks, so I didn't want to blow it and like kind of maybe hurt my nose or something, so I was avoiding that. And yeah, so basically I was sniffing a lot all day, so I wasn't sure what to do about it, so I texted Dr. De Silva just a quick question, so like could I use something on my nose, like nasal spray or something maybe, just to clear my nose out. And apparently your nose can sometimes, obviously where it's swollen on the outside, sometimes the lining of the nose can get a bit swollen on the inside. So it's kind of like when you get a congested nose, basically kind of when you get a cold where you're not blocked up, but you're just not breathing as well, because like I'm assuming the back there is a bit swollen. Anyway, so that's what it felt like, and it was a bit annoying, and I was struggling to breathe out my nose like I had a cold, so I was breathing through my mouth again, which I was trying to avoid because my lips got quite dry, where when I did have the cast on, I definitely couldn't breathe through my nose. I'd be breathing through my mouth all through the night and I'd get really chapped lips. So I'm trying to kind of get more into the routine of breathing through my nose again, because obviously once you have like started breathing through your mouth constantly for a week or so, you kind of forget and you don't breathe out your nose. Sounds weird, but it happens. So I was trying to think of ways that maybe I could release my nose again. So Dr. Silva suggested about the nasal spray, which I did buy before the procedure because it was on the list of things like medicine or drugs or whatever to buy. I hadn't used it because I thought obviously I can't use it when I had the cast on because I had like blood all in my nose. So I thought, oh, I might as well give it a try if I bought it anyway. So I just did it, and it tickled quite a lot and it felt a bit weird, but no, it seemed to work pretty well. It emptied my nose out, and that kind of gave it a good flushing, and now I can breathe out my nose, which is good. It didn't hurt. When I was like kind of after I did the nose spray, when I was blowing my nose, it felt a bit weird, and I didn't blow it very hard because I didn't want to like kind of hurt myself. So yeah, just take it gentle, like I did, and it works. So now I can breathe out my nose, which is nice. So it's a leisure that you kind of forget you have. The other thing also is, since I've had my cast taken off, I've found that I've got quite bad skin. I think I mentioned this the other day. So my nose was quite peely and around there. One of my friends, she had her arm in a cast. I've never had a cast on except from my nose. But one of my friends had a cast on her arm, and she said that did the same thing, like her skin peeled for some reason. I don't know if it's because it hasn't had much oxygen or whatever, but it peeled. So today I think I've got most of the dead skin off now over a few days, because the way it's sore I don't want to rub it too hard. So I think I've got most of the dead skin off now, which is good, because when I put foundation on it won't look as cracky. So that's always a nice thing. So nice fresh skin. Only thing is, I'm assuming it's where when I had the cast on, like the thing there, I couldn't, and where it was sore, I couldn't wash very well around my nose, or not like a good deep scrubbing. And obviously where it was quite greasy, where I couldn't wash around there, and it had the tape, and obviously the blood. I seem to have got quite a few spots around my nose, around there, like just like bad skin basically. Lots of like tiny little block pores around my nose, just around there. So I don't know if that's just my experience or if most people get kind of bad skin around the edge. So I've given it a good wash the past few days and it seems to be getting better, but it was just a bit sore first of all. So I've given it another good wash tonight. And now it's getting a little bit less sore on my nose. I can give it a good scrub. So hopefully in the next few days those will go away. But obviously when I put makeup on it doesn't really make much of a difference. It covers it up pretty well. So that's about it really today. It was just mostly my experience of my first day at work. I'm not sure if anyone noticed. I'm not sure if it's all in my head. I thought I saw a few people look at my nose, but like I said before the other day when I just went out the house and people look at me, I doubt, in fact no, I know that people couldn't see a difference on my nose or see the scars because they were far too far away, and my boyfriend was sitting right next to me and he said he could only just see them, so there's no way they could have seen it. So it's all up in your head, so don't worry, you're going to be a bit paranoid about them. So just go with it. They can't see them, especially when you're wearing makeup if you're a girl, or if like kind of I don't know how guys deal with it. Like, do guys put a bit of concealer on? I don't know. I don't see why not. But yeah, don't be worried about it. They're not going to see it, and even if they do, it's so subtle, the scarring at the moment where it's fresh. Even when I went like that to my mum, she said she could like only just see the scar there, and the ones there, it just looks like I've had a cold, my nose is a little bit sore, and that's once I've taken my makeup off. So with the makeup on, you really can't tell. So don't be worried about it. Yeah, so I think that's about it today. I've got my second day at work tomorrow, so that'll be day 13 of recovery. Now my nose is a bit clearer, I'll probably be a lot less self-conscious, because I felt like where I was sniffing, people looked. So tomorrow should be a better day. So yeah, I'll let you know if anything changes. I haven't had any nosebleeds or anything yet, because I know apparently some people do. Haven't had any nosebleeds. So yeah, it's been pretty good so far. I mean, like one of my friends today, when I went out for a meal, she said, because it's the first time she saw it with the cast off, and even she said that she was happy like with what I had done, like my choice, because it looked natural. Like if she didn't know me, she wouldn't realise I had a nose job, and that was one of the things my friends were a bit paranoid about, is that they know I'm a smart girl and they know that I do my research, but obviously they're always going to have their doubts that it could go like some crazy Michael Jackson nose or something and look really obvious. So they were all really pleased with the results as well as myself, because obviously it does look really natural, and it kind of is still in conjunction with the shape of my nose originally. It's just more like reduced around there and slightly more refined. So I'm happy, they're happy, my mum's happy, so it's all good really. Just looking forward to the swelling going down and getting my feeling back. It's still a bit numb, so it still feels a bit weird, but how often do you touch your own nose? So it's not that big of a deal. So yeah, I'll let you know what happens on day 13, did I say? I think I said that, day 13. Yeah, I don't think anything will probably change, but I'll let you know. So see you tomorrow. on my second day of my new job and day 13 of my recovery from my rhinoplasty. So see you then.